All right. So is everyone seeing my screen? Welcome to season 8. Everybody seeing it? Yes?
Yeah. Yes.
Okay, good, good. So, as the screen says, welcome to season 8. We are down to about the third to last episode of this season 8. If you want to learn some more about Environmental Fridays, you can use the QR code at the bottom right, or you can go to www.theenvironmentalfridays.com. So this has been our speakers mostly. We've had some changes and stuff, but this has been our speakers. It's a photo gallery. We have
Mm.
two more
That
sessions.
we don't see that, Desmond, actually.
You know,
We just no, we just see Dr. Gardner's Allergy and Asthma Network slide.
No,
okay.
I'm seeing it. I'm seeing the photo gallery.
Me too. Oh,
Okay.
whoops. I'm gonna sign out and sign back in and see what that.
Okay. All
Oh,
right.
there's a choice across the top between whose screen I see.
Oh,
Okay,
okay.
interesting. Never mind.
Yeah, they keep changing things around on on Zoom, so maybe that's a new option. So we have two remaining speakers, two remaining episodes um, coming up, and we may have a change in the faces there too. So stay tuned um, for that next week. So, as I mentioned, was mentioning earlier, Environmental Fridays is being brought to you in partnership with the American Chemical Society Committee of Minority Affairs. American Chemical Society is the largest global single discipline organization. Benton Spirit, I've been with Benton Spirit for since its beginning and been editor and our publisher and um, executive director, Princella Tobias, is on here. And I will refer to Benton Spirit coming up here pretty soon in connection with asthma. And as I said earlier, GC scored Every Piece Matters. That's a social, emotional wellness organization put together by my sister. She's a teacher at um, what is it? South
Yeah,
Bend,
Indiana
Indiana
University.
University in South Bend. Yeah.
Mhm.
So, if you would like to join us on Facebook, you can just go to Google and put in Environmental Fridays Facebook, and the first hits you will get would link you to our Facebook group. Everyone is welcome to join and be active on the Facebook group, put up news and features and stuff dealing with the environment. Similarly, we do have all of the episodes on YouTube. To find them, you simply go to Google and put in Environmental Fridays YouTube playlist, and that will get you the links to all 8 seasons. Can't have lost count of the number of episodes, but it's a lot. For this season, if you want to specifically look at this season's episodes, again, you could use the QR code and or the link will get you there. So, as I mentioned, as I hinted, the Benton Spirit, these 2 pages that you're seeing right now on my screen come from the Benton Spirit, comes from actually today's issue of the Benton Spirit, May 2, 2025. And for those of you who are capable or in a position to get a hard copy, we encourage you to do so of the Benton Spirit. It's been delivered as we speak now. And it's also found online at Benton Spirit. You just look it up, Benton Spirit Community Newspaper, look it up online. So, um, first of all, we have a program that's called A for Asthma, the A for Asthma program that's been about 2 years, 3 years.
Going on 3.
Yeah, okay.
Yeah.
And it actually is sort of an offshoot. It sort of started here on Environmental Fridays when Dr. Susan Buchanan, who you guys just saw speaking there earlier, and Princella Tobias, who I don't know if you could see at the top in the right column there, she um, listened and made a connection. Hopefully, we'll make some more connections here with Dr. Gardner today. And so that's how essentially A for Asthma was born, that program. And one of the things we want to announce now is that on Thursday, May 29th, there will be an event at which we would have asthma doctors, asthma education workshops, a whole list of different activities that will be featured there. It starts at 5, goes through to 7 p.m. Doors are open at 4. The location of, again, for those who are here in the area, is the Secret Garden Event Center that's on West Main Street in Benton Harbor. And you could see some other stats. So I would try to make sure that whether you are um, here locally or online and further away, that at least these 2 pages within the Benton Spirit will be made available to you somehow online. Okay.
Dr. Murray,
In, Go ahead.
if I could, we are so blessed and pleased to be able to do what we've been doing for 3 years, helping so many people in our community that have been suffering with asthma and been able to support them and educate them. And that has been made possible by Best Early, the Benton Spirit, but the University of Illinois Chicago Public Health with Dr. Susan Buchanan and her team has been vital via EPA in helping us to do this for so long. And I just wanted to give them credit because sometimes we have an idea, we have a dream, we meet people and our hearts ache for what they're going through, and we just want to help them. And we cannot do that without the support have received from the University of Illinois Public Health. And now moving forward with this event that is happening on the 29th of May, that has been made possible with the members, the team that I just spoke of, and that includes DC scored. Emotional health is so important because we have lost loved ones who have died from asthma in our community. But this year, we are so pleased to say that the state of Michigan Eagle, Environmental, Great Lakes, and Energy is now one of our partners, and they are supporting us with our endeavors to support, educate, and love and bring people together to know that they're not alone, that we're here to help them in the best ways that we can to be educated and also to fight triggers. So we have a team that's working together. And I just thought that was important to let people know. Thank you.
All right, very good. Thanks for that. On again, page 3 of the current Benton Spirit is a selected list of persons who may be famous that have asthma. Billy Joel, Martin Lawrence, Elizabeth Taylor had it, Jackie Joyner Kersey, Dennis Rodman, Emmett Smith, Jesse Owens, politicians like Theodore Roosevelt, Bill Clinton, John F. Kennedy. So those are some, Lenny Kravitz. Those are some persons listed in our newspaper this week. And so we encourage you to look that up. And thank you for at least paying attention to this program and this organization and our effort to reach out to persons who are suffering from asthma. Okay, so we'll move along. So today I am honored to have with us as my co-host, Alyssa Sussdorf. She's a student at Andrews, a PhD student at Andrews in counseling psychology. She has already obtained a master's in clinical mental health counseling and a Bachelor of Science in pre-professional psychology. Currently, she assists faculty on international research projects based in Trinidad and in Nigeria. She volunteers weekly at Harbor of Hope, which is a church in Benton Harbor, where she mentors youth and participates in humanitarian efforts, including during the 2021 Benton Harbor water crisis. She understands that environmental neglect disproportionately impacts Black and Brown children first and worse. She brings this passion for advocacy, healing, and justice. And she sees caring for the environment as a vital act, a vital part of social justice. So it's good to have you on here, Alyssa.
Thank you for having me.
Yes, it's a pleasure to have you here. So she just completed, this was yesterday, I guess, was the last day for the semester. This weekend is graduation weekend here at Andrews. So it's good to have you here. So now it's your turn to introduce our speaker for today.
Hi, yes. So today we have Dr. Dee Dee Gardner. Dr. Gardner is the Chief Research Officer at the Allergy and Asthma Network. She holds a doctorate degree in public health with a concentration in leadership, policy, advocacy, and community health from the University of Texas Health Science Center in Houston. She has been a respiratory therapist for over 30 years, and Dr. Gardner oversees the research mission of the Allergy and Asthma Network and partners with other nonprofit organizations, academicians, and community organizations to conduct research using qualitative methods with a focus on health equity in the asthma and allergy space. So we are so happy to have her today.
Oh, I'm sharing. There you go.
So is everyone seeing my screen now?
Yes.
Yes.
Great. All right. I appreciate the invitation. I believe that our CEO, Linda Mitchell, was going to try to come, but was unavailable. So I'm excited to be here today because environmental health is something that I'm interested in. I do recognize that we have about 40 minutes or so to present and then to have some time for questions. Please feel free to ask questions or stop me if there's something that isn't making sense. Happy to address as we go. But the mission for Allergy Asthma Network is to end the needless death and suffering for people with allergies, asthma, and related conditions. And we do that through 4 pillars, one of those being education, the other is advocacy, outreach, and research. This week, as we come upon May 5th, that's going to be, May 6th is our World Asthma Day. And so advocacy is something that we are very ingrained in this week. We are headed to DC on Monday. So again, the mission areas that you see here, we'll go through a few of these, but really our work is actually looking at people across the globe who are impacted, whether that be caregivers or people with the disease themselves, healthcare providers, and others who really want to try to change behavior, take an active role in managing their health. We want to help people to become aware of resources that are available to them, be committed to them. That is one thing that Allergy Asthma Network has been partnering with churches, communities of faith, other nonprofits, other organizations, again, to create community to where we're not a one-stop come and be there for a minute and then aren't seen again. So we do have relationships with a number of professional and community health organizations so that we're attending health fairs, going to the community year after year, so that is our commitment to the specific communities that we've been a part of. in our outreach mission area, we're really trying to grow some of the community engagement that we have by connecting with individuals to promote fairness and health access to improve health outcomes, and then also to promote awareness and motivate people to pursue appropriate diagnostic and therapeutic care. And in doing that, that's helping people to either garner access to medications and treatments that are available and should be available to all people. So we have public awareness campaigns. This last year, we had about 14 billion media impressions. We utilize the number of tools similar to what Dr. Murray just shared. You know, we have Facebook. We utilize social media. We have a presence now on Threads. We've been on X. We're looking at, we've been on LinkedIn. We're also started a TikTok channel because we find that many people are going to TikTok or to the internet to find information about the disease they have, even though that information may not be credible. We want to be that credible resource and make sure that it's evidence-based that we're sharing. And then we also partner with a number of health practitioners, whether that be a community health worker all the way to a physician, to, again, have that evidence-based insight. And then we want patients at the table at the beginning of all research. And patient stories are extremely important when we're talking about outreach and when we're talking about advocacy. So we have some interesting websites that do incorporate environmental health. One of those being our Spanish website. It has been relaunched this past 2024, and it is now mobile friendly. So the materials that we have on our traditional Allergy Asthma Network website are also on our Spanish website. We've created a few websites specific to medications, a disease called EOS asthma, which is eosinophilic asthma. It's an asthma that really you have a high level of cells that are considered eosinophils. And so there's a specific website just for that. And because skin disease does fall within the Allergy Asthma Network scope, we recognize that skin disease doesn't always, and nor does it ever, appear similar on more pigmented or darker skin. So we have taken time to work with our community of people of color from the Black and Brown communities to visit with us, have focus groups, share images to help practitioners recognize that eczema and other skin conditions, it is taking sometimes 7 to 10 years for diagnostics in our Black and Hispanic community, which is unacceptable. And so we are really working diligently to change that scope. On awareness days, as I shared, next week is our World Asthma Day, but we also have, World Asthma Month is the whole month of May. We have some food allergy awareness weeks that are coming up here in the next week or so will be the food allergy week. We have immunization week. And so we try to educate and provide credible information along all types of threads that would be impacted by a person that might have asthma. They might have skin disease. We even promote clinical trial awareness because we want people to recognize that clinical trials can be a health option versus it being a last-ditch effort or being afraid of participating in clinical trials. In regards to education, we take accessibility extremely to heart. We want to make sure that all of our resources are accessible, but also we've taken a point to translate our materials into Spanish. We recognize there are other languages that we really need to be focusing on, but at this moment in time, English and Spanish are the two that we have funding to do so. And we are trying to make sure that all of our materials are patient driven. So again, we have patients who are part of an advisory board that review our website to ensure that we have inclusive visuals, that we have clear communication across print and digital platforms. We want to guarantee that our web content, again, is accessible for anyone that needs accessibility so it can read to you. It will, the colors are always being evaluated by our compliance officer so that we can assure that we're meeting the expectations and the standards that are appropriate. And then we're creating, again, that community that we have. The patient advisory group comes in. Again, they're advising us all of the time. We meet monthly, if you will, to ensure that we have relevant, respectful, and culturally responsive materials that are going out to patients. The webinars, social media videos, we provide webinars in a couple of different ways. Again, we have been focused on the Black and Hispanic community over the last since 2019. We are also interested in the rural community. So what we have done is we've applied and received PCORI funding to during the wonderful pandemic. We had PCORI funding to provide patient education with patients at the forefront who were leading the advisory groups to determine topics that we could share. And then also with the Hispanic community. So both groups met and had their own series, came up with their own titles, their objectives, what materials they wanted to see in the webinars. And these were associated with asthma, COVID, and future directions. Again, trying to have the community introduce what was going on in regards to the pandemic, but then also giving people options and choices on if they were interested in participating in PCORI research later on. We also partner with a podcast called The Itch. This is led by Dr. Payal Gupta and a patient. Her name is Courtney Kwong King. Both of them are able to have a conversation about any disease. We right now have two different types of podcasts that are taking place. One of those is a patient-driven podcast. The other one is a healthcare provider-driven podcast. So the patient-driven one has the patient and the physician where they're having conversation about a disease or a study, and then the patient asks questions on behalf of other patients so that all of us are on the same page when it comes to research. We also have something similar to a Blue Journal or to a journal conference on that podcast where physicians, the study PIs are talking about the study, and then we bring in the patient. So 3 people having a conversation about a study, and that has been going really well. I believe that we've reached 100 podcasts at the end of 2024, and these are on a YouTube channel as well. We've worked with a number of patients, a number of healthcare providers to learn from them as to what's most important when it comes to asthma and their health. So the topics that we're looking at are very wide ranged, but still our main focus is asthma, atopic dermatitis, and then other food allergy type of diseases. We recognize, that patients with asthma there's a high percentage of people with asthma who also have food allergies and have skin disease, so that no one comes to the table with just one disease. Many times we come with numerous comorbidities. So we're trying to address each one of these, but we have to demonstrate that there are overlap diseases within us. We are a partner of CDC, and we recognize what's going on right now with the administration, but in the meantime, we are continuing to move forward with our Exhale program. The Exhale program has a number of resources for those of you that are interested in asthma. The goal of the Exhale strategies is to reduce asthma-related ER visits, hospital stays, and deaths among children. And so we work with the 29 asthma control programs across the country through education, newsletters, and also partnering depending on what's going on. As you can imagine right now, we're having quite a few meetings to determine next steps. We host an asthma summit also where we bring in the 29 different state asthma program representatives. This last year, we hosted this at the American College of Asthma, Allergy, and Immunology. We had over 100 people in person. There were about 800 people who attended virtually. Our next one will be November 7th, 2025 in Orlando. This will, I provided you with the URL, and I've also shared this handout with Dr. Murray so that he can share that with you later with the links to the different parts and pieces that we have sharing with you guys today. So this week is our advocacy week. We have advocacy policy priorities. These are something that has been established over the last few years. We are working with our legislative aides and others to ensure that we are improving access to medical care and treatment for all. We want to also improve and retain asthma allergy program funding. We'd like to reduce the health risks for allergy and asthma emergencies, mitigate the environmental health hazards that exist, and then advance the access to healthcare for all. This last year, we've had some grassroots advocacy opportunities where we were able to submit 1,500 different comments and letters, testimonies, state and federal legislation and regulations to support different needs that fit those priorities that I shared with you earlier. We've also, again, right now we're meeting next week, so I can't really tell you what the funding will look like. But last year we were able to include the Consolidated Appropriations Act. And then there were 14 bills in Congress that helped secure language in the FAA Reauthorization Act, which included updates for anaphylaxis and crew member training on airplanes. The language for epinephrine and anaphylaxis is an evolving time right now because there are new opportunities for for epinephrine to treat anaphylaxis. For the longest time, we've only had these needle EpiPens, if you will. And now there are new devices coming on board, one of those being a nasal spray. And then in 2025, 2026, we may see a film that dissolves under your tongue coming to market. So new language has to be supported for that epinephrine language to treat anaphylaxis. And then crew member training is extremely important. As I'm sure you've seen, a number of our influencers have passed away recently from being exposed to a food that they have had anaphylaxis. And so they didn't have access to their epinephrine or something else occurred. We're seeing a number of concerns on airlines. And so we are working really hard with the FAA to move this training forward. We also support bills. We have here, 50 plus state bills in 2024 to move those into law. One of those being the Elijah's Law. This is food allergy training and anaphylaxis awareness in daycares. We're also looking at prior authorizations and step therapy so that epinephrine inhaler cost caps are being considered. We had 94 advocates, 29 states represented in 2024. We're expecting very similar return this year for next week. We just met yesterday to talk about the number of people that are attending our advocacy day on Wednesday. So we do have about that same number coming again. And we'll see a number of co-sponsors with the House and Senate members signing on for targeted bills. And those we can share with you at another time. Our advocacy day, you can still join if you're interested in doing that, or if you will actually join, we can be sending you templated emails for different types of bills that may be needing to go forward with support. Again, these bills are for all. It's not just focused on asthma. These can be focused on access to care, medications, different pieces of legislation that need to go forward. And with constituent support, that's how we make a difference. So the louder we are and the more emails people receive, the better hopefully change can happen. So in regards to research, our research, actually, we try to ensure that research is reflecting patient experiences. When I started as a researcher, I thought that I was the one that was actually the expert in what was taking place. I went to enroll my first patient, and this was not in asthma. This was actually in Lou Gehrig's disease. I went to enroll my first patient and shared with them all the wonderful things they would do in this research project. And the patient said, in their broken language, because of ALS, takes their speech. But he informed me, he said, "Do you really think that that's realistic?" And he said, "I spend, my wife and I spend about an hour to 2 hours getting me ready every morning. Then I have to do treatments and therapy. And then by then it's noon. And then you want me to do these other things. And then by the time I get to the afternoon, I'm wiped out. And then you want me to do more things." So right then I realized the patient was the expert and I was the learner. And so I went back to my team and we made adjustments based on the patient. And I will never forget that because I feel that it's made me a better researcher. So coming to AAN has really allowed me to really help patients put themselves first when it comes to reviewing protocols, evaluating the materials that are promotion materials for a study, They've been able to change that. We've seen that over the last couple of years with some of these marketing materials that you may be seeing, rather that be on your telephone or on your Facebook or ads and so forth. We've really been able to have patients make a difference in those. And then we encourage people to participate in clinical studies. We recognize not everyone is interested in doing that, but even if people aren't interested in participating in studies, they can still support the concept, because we would not have one medication today if it wasn't for a clinical study. All of us who are healthy can participate in a study as being a healthy subject, or we can share studies with people who might be interested in participating. Again, I stress the importance of clinical study education, because we recognize the travesties that have occurred previous years before I came into research, and there has been training to help to avoid those types of situations from ever occurring again. We need to ensure that our clinical study primary investigators and co-investigators, the people who are consenting, all are trained to ensure that patients' safety and anonymity are taken care of. We also want to ensure that the study protocol is followed. And then the biggest piece is for the researchers to share the study findings back to the people who have participated. That is where we really need to partner with our researchers, industry partners, and academicians to ensure that their results get out, even for results that may not have demonstrated the outcomes that we wanted. That's okay. We still need to get those outcomes out to the patients so that they're aware of what went on and the impact that that can have. We need to build partnerships to lead to publishing those findings. So the contributions that AAN has been involved in over this last couple of years, we've served on a number of guideline committees. We've advocated for patients to be present on those guideline committees. Guidelines are only as good as the literature that is published, and that is the way that it goes. But patients need to be at the table when those guidelines are being developed so that the right questions are being asked. I may be a practitioner and I may not see the question. I may see a question differently than a patient sees a question. So we need to make sure that patients are at the table when it comes to guideline development, and to have them be a co-author on the guideline, and to also help write the plain language summary for those guidelines. Again, guidelines are really for practitioners to make a change or make a difference on how they're doing the treatment, therapies, diagnostic tools. But patients need access to those guidelines to see what that looks like and to be involved in the process, but then also have a plain language summary that is shared with all. We've had a number of research partnerships develop over the last few years, and we've been able to promote patient voice within studies. We've been publishing studies with patients as co-authors over the last 2 years. That is something relevant and new for AAN. We've also been awarded an NIH Small Business Initiative. This award helped us to move our asthma program forward, and we just had our third phase evaluated last week. We're waiting on the results or the findings to find out if we'll actually receive the funding. We've collaborated with industry partners. So all of us need to be at the table. And when you think about environmental health, we do need our industry partners at the table. We need our patients at the table, our nonprofits, our faith leaders, our legislators, our policymakers, our healthcare providers, all of us, our public health practitioners, all of us need to be at the table when we're looking at research collaborations. And so that is something that we hold dear here at AAN. We will promote studies for academicians, for nonprofits, for industry partners. We do share with patients. That's the only way that people will learn what's going on, because sometimes healthcare providers aren't comfortable sharing studies, especially if they're not the one running the study. So we have a research newsletter that goes out to about 60,000 subscribers, and that some of them are patients, some of them are caregivers, many are healthcare providers who are willing to share that information. So in regards to outreach, we have a program that is that we refer to as the Trusted Messenger. We really want to be that trusted messenger when it comes to asthma education, resources that people are looking for, so forth. So this Trusted Messenger program began in 2020 in February, right before the pandemic. And we were working in Atlanta, Georgia at the Ebenezer Church with a gentleman, a healthcare provider, a pulmonologist, Leroy Graham. Leroy Graham had recognized over the years that he had seen a number of young Black children die from asthma because they did not have access to care or the medicines. He partnered with AAN, and we went out to provide education in at the church health and wellness events that they were hosting there in Atlanta. Unfortunately, when the pandemic hit, we were no longer allowed to travel or be available for people. So we moved the program to an online virtual option, and we were able to provide education through webinars like what we're doing today. And then in 2022 is when we were able to get back out into the real world and start our program again. So the Trusted Messengers program, we actually partner with we partnered with Ebenezer Church, we've partnered with Piedmont Health, we've partnered with Right to Breathe, the Latino Connection, with a Black Health Matters group. So whenever they're hosting their health events, we go out to those. So since 2021, we have actually engaged about 5,500 people. We have people invite them to participate with us so that we can continue the relationship with them after we leave these health events. We have them fill out a health survey. That survey asks some questions in regards to, do you have asthma? Would you be interested in an asthma education program? Do you have eczema? Do you have food allergies? Do you have COPD? Do you smoke? And we tell them that if they want to be a part of this, that is wonderful. If they don't, that's okay. Out of the people who have completed those surveys, we've had about 900 people who are eligible for our asthma coaching program. And I'll talk about the program itself here in just a second. But that program is actually a free asthma coaching program. It is a study, and we do share that with our constituents that come to our table and talk them through what is going to take place. It has been recognized by a number of organizations for the connectivity that we have in regards to diversity and being recognized as a finalist. So we are able to meet people where they are at these health events, encourage them to be a part of research if that's something they want to do. And then we also offer the asthma education program. So the Trusted Messengers program, again, is awareness and diversity. So we're really focused on encouraging all people to participate in, to take care of themselves and to participate in research. Again, we've partnered with the local churches, faith-based organizations, different colleges and universities, and then healthcare providers who want to contribute. So this last year, we were able to participate with 20 different communities, offer free asthma education to those who are at high risk for poor health outcomes. And then we've been continuing this relationship forward. So let me move forward here. These are the states that attendees have participated in our outreach events. And again, like I said, we're partnering with those other organizations. So if they're in California, then we're flying to California, setting up a booth, working with them. And then we're coming back year after year after year. So the major conditions that we're seeing at the outreach events have been the ones that you see here with food allergies, asthma, and eczema. And that overlaps with what our focus is. Number of people come to the table with numerous allergies, and allergies can be environmentally driven. So the people who choose to fill out their AirQ or their asthma assessment, we find that people who attend the events actually have uncontrolled asthma. And so they would really benefit from being involved in an asthma education program. So the asthma education program is a virtual, free, one-on-one, 6-week education program that encourages trust in the healthcare system, provides culturally meaningful education materials. And again, it's one-on-one for about an hour for 6 weeks. And then we follow those participants for a year to have them share with us, again, through either telephone or virtual, to let us know how they're doing after the education. Our goal is to see that their healthcare utilization has gone down, their self-management skills have improved, and that their asthma control has improved. So they're able to get back into life, right? That they're not being isolated or unable to participate in work or school if that's what they choose to do. Right now, the program is for people who are 18 and older, because the reason that we went with 18 or older is because we have seen from the data that there are more deaths in adults, because adults, moms and dads, grandmas, tias, aunties, opt not to care for themselves and opt to care for the children, which is important. But we want them to take care of themselves so that they're here to take care of their children. The majority of people that have participated in our program, you can see the breakdown here in regards to the demographics of the 250 people, or almost 247 people who have participated. So the asthma control over this last year, the people who identified as having very poorly controlled, not well controlled, or well controlled asthma, we did see that they had improved asthma control test scoring. The 67% of them actually improved their scoring. We did also see that of people who had poor asthma control or uncontrolled asthma, there was 119 of them, that 47% or almost 50 actually reported a decreased use in steroids. Also, their emergency visits went down, and the number of asthma doctor visits went down after the 6-week education program. We saw their quality of life improved, and leaving the asthma education program and moving into more of a public health aspect, we acquired a Asthma Equity Explorer database from MITRE in 2024. This database allows researchers like yourself, community partners, and academicians to identify asthma prevalence against about 30 other type of variables. It drills down to census tract. It also includes information for every state and census tract in the United States. And then you can create maps to help you with your grant writing. You can also download the data and analyze it differently than the way that the Explorer database allows us to. The database has had quite a few people participate, as you can see here, and we are actually presenting one of our abstracts in a couple of weeks at the American Thoracic Society. So with that, I will stop because I recognize we said we would have about 15 minutes for questions. We've gone through quite a bit of what AAN does, but in regards to environmental, I will let you know, we probably could do, 2 or 3 other presentations in the future, but we are very aware of being conscious about the footprint that inhalers are making on the environment. Inhalers are plastic, so we recognize there's a concern there, and there are a number of people doing research in that area, and we've been a part of that. We also recognize that these devices also put out a different type of gas, if you will. It's less than 1% of gases that's pushed out, but again, it is contributing. So it is something that we need to be conscious about. And again, there's other, indoor air quality, outdoor air quality that we are very concerned with. And so we provide education in that area. So again, there's opportunities for us to return or have one of our other colleagues present.
Oh, we definitely putting you down. Yes, and like you said, you don't just do one and done type of thing. You basically come back over and over again. So yeah, could expect us to be requesting you to come back over and over again. So,
Well,
Susan,
happy to do so. Happy to bring some of our team. We've just hired a new advocacy director. She's very skilled in the policy side of what we are trying to do. So again, I feel like we could definitely have a great long-lasting relationship with a number of our members.
all right, very good. Susan? So
Yes, thank you. Yeah, we're trying to get my audio to work. Thank you so much. That was really informative and clearly overlaps with some of the very local work that Princess is doing with the A for Asthma project, a lot of outreach and education. I had a couple questions. Sorry, the first one is I love that asthma equity mapping tool. And who hosts that? Does your organization host that?
We do. We do host this. If you go online to asthmaequity.org, you can create an account, and then from there you can start using it. We are collecting information so that we can share with funders. Look, we have 1,000 people using this. It's been utilized in grants, what have you. So it is available, and it was just updated in December. We were able, thank goodness, right? I mean, in December, we downloaded all of our CDC data, the other tools. We use green spaces. There's some information about the housing authorities. There's pollen and so forth. And so all of that data was downloaded and then put back up into the Equity Explorer database January 5 or 6, somewhere around there. So we do take it down for a period of time. We do update it. And so it's updated as we know the data is being current. We want it to be as current for everyone to use.
Great. And my other question has to do with the educational topics slide, because one thing that we focus on with A for Asthma is air quality. So
Yes.
outdoor air quality with AQI, indoor air quality with all the kinds of triggers that are in the home, with using natural gas for cooking and dusts and pets.
Yes.
So
Wait, Susan, unmute Susan.
oh, I'm so sorry. I don't know how I got muted. That's so weird. Anyway, we spend a lot of time with A for Asthma on indoor and outdoor air quality, AQI, and indoor triggers and pets and dust and using natural gas for cooking. So it clearly plays a big role, and even there are instructions for asthmatics for what they should do based on the air quality outside, which gets pretty bad in the summer. So I guess I would just advocate for that, including the educational topics. I guess now I'm seeing there is indoor, outdoor air. So do you cover AQI and pets and dust and stuff? Yeah.
Yes, the word quality is missing on the bullet. I see that now.
Okay.
It should say indoor, outdoor air quality. And we do provide in our asthma program. And then when we are at the outreach events, we do have a environmental trigger and mitigation trifold, if you will, that helps people to identify and then links them to our website. We do have a kind of a color book for children. It is called the Indoor Air Repair, and it's cartoonish and walks kiddos through why they need to clean their room, being messy versus being organized versus being messy or what have you. So there's some cute little tidbits in it.
Oh, I bet you're going to hear from Princess about that coloring book, getting her hands on the coloring book.
That'll be great. That'll be great. Yes.
Thank you.
Yeah, and in our asthma education program, we do, because we are virtual, we do ask the participant, if you're comfortable, share with us, you can walk us with your computer or with your tablet or with your cell phone, into your kitchen and show us what you have, and then we can help you identify some of those concerns that need to be addressed. And then also in regards to policy or housing authority type of templates, trying to work with the websites that are on EPA and so forth, trying to make sure that people have resources if they're needing that type of resource.
Okay. So Yvonne, before I get to you, I wanted to see if our co-host, Alyssa, did you have any comments, questions?
Can you hear me?
Yes.
Hi, no, it was a really good presentation. Thank you so much for sharing. And I guess my question is for myself, or mainly for myself and those who are not directly involved in like environmental work, but understand that this is important work. How can we get involved and how can we advocate? Like for me, like I have a degree in counseling, and I serve populations who are impacted by we're all impacted by the environmental decline, but like how can someone like me who's not in the field, but how can I still advocate?
Sure. So my answer would be kind of a three-part answer. One of those is that we would love for you to be involved by joining and filling out a form on the allergyasthmanetwork.org website to volunteer. And there's there's numerous things you can check off that you'd like to volunteer for advocacy, you'd like to volunteer in the outreach, you'd like to volunteer here. But in regards to counseling, I'm going to put a plug in for our asthma education program because we come across people who, when they fill out a survey that demonstrates that they are having concern about depression, or we know that people with asthma who don't have their asthma controlled, that they become isolationist. And so then that leads down this cascade. And so we would love to partner as a resource, like if a person that we're noticing having this concern, that we could send them to you, Alyssa, or to someone like you, that they could meet with you, or, again, recognizing that there's insurance and all of these other things that might need to take place, but maybe you might have resources that we would be able to share back to our participants in the asthma education program. So I think that, that's twofold. And then third is for us to continue a conversation after this to see where our strengths are that we could then overlap.
And then one more question. I think you briefly talked about this, but the inhaler itself is made from plastic.
Yes. Yes, it has metal. So this picture here, the encasement on the outside is plastic. The actual medicine, this metal piece is where the medicine lies. But this plastic piece is thrown away. And so it just sits there, is my understanding.
And does the person reuse this plastic part of it,
No.
or do they just get thrown away?
They get thrown away. The whole thing gets thrown away, and then they get a new one. And then depending on how long this one lasts, some of them may last a month or a month and a half. Some might last 2 months, but every time they renew, it's one more whole entire device that the person receives. And on top of that, this is just one device. There's actually about 15 or 16 different inhaler devices, and all of them have plastic on them.
Mm.
Okay.
And even the propellant to make the spray come out, years ago, I want to say in 1997, 98, somewhere in there was a big push to change the propellant because the propellant was creating ozone, if you will. And so people were having reactions to that. And so we've moved to a new propellant, and there's actually some newer propellants for these inhalers coming out. I would say pretty soon. The studies are still, one industry partner shared a study this morning, actually, about a propellant that the study looked pretty good. So happy to send that to you, Dr. Murray, to share with group. It's a public statement that we can share.
All right.
Yeah, so there's some new ones coming out too.
Okay, so Yvonne.
Okay. So it was a very informative presentation. And the young lady who just asked a question about counseling, basically, that's where I was going to go. What type of mental health, emotional, social support? Because of course, you will see some of the environmental factors impacting people's mental health and well-being. Do you guys have in your program, so the education topics, that was not one of them, and how would you incorporate that? And I'm offering for my organization to partner as an education vehicle in the talking about the mental health effects, the effects of asthma and how it interplays with mental health.
Right. So we have we are lacking in the resources for mental health. That is an area that we recognize that there are people like yourself who are the experts that we need to partner with. We do receive calls, emails, and people that come to us. Some of our patient partners who are on our advisory committees have lost children, husbands, wives to asthma. And so we really want for them, they want to advocate. They want people to get help so that they're not in these situations. So we would love to have the opportunity to have a conversation with you and figure out how we can partner and also figure out ways to provide resources to our participants who are in the asthma education program. Because right now We are contacting, for some states, there's the phone number for 411 or 222, depending on the state that you're in.
Mhm.
And so that's what we're reaching out to then inform them that we need help for, for whomever it is that we're speaking with. And it hasn't happened a lot, but it has happened. And we do want to expand that part of our offerings.
Yeah, thank you. That would be, so you can share your information with,
Yes,
yeah. Thank you so much.
I would love it.
So we have a question. We have several questions in the chat. John Goodman from South Carolina is interested in the indoor air quality solutions. John, are you still there to expand on that, or?
Yes, I'm still here.
Okay.
I have a company that offers indoor air equipment
Okay.
that are different from the average air purifier, in which it makes hydroxyls that help eliminate the pathogens in the air. And we have an ionizer type antennas in it that take the dust particles out of the air too.
Fantastic. Well, I would be happy to invite a conversation later if we could meet up through Zoom and learn more about the products that you have and see how we might be able to communicate those out to our community.
That would be great.
So I'm just wondering, should we charge a referral fee?
If you're a 501(c), I'll make a donation of the profits.
All right. Sounds good. That applies to my sister too, and Alyssa. Yeah, you guys
Great
are
networking.
a great hookup here, man.
I'm telling you.
Dr. Murray, you create the best space, for people to come together from all these walks of lives and get together and find that we have some synergy and crossover where we can be powerful.
This is
He
right.
really does. And that
Exactly.
leads, I don't know if you had another question, but
Okay, Gwen.
after that, I would like to,
Okay.
I
Gwen.
have to, okay, go ahead with, yeah, definitely go with Gwen.
Yeah, so Gwen has a question. Gwen, do you want me to read it or you want to just come on and
I just had a question about accommodations for students. Since asthma is, a health disability, it'd be classified as a disability. Have schools ever contacted you about what accommodations should be set up for students as far
So
as
when
their
they
educational accommodations?
Yes, so when they do, I actually we will refer them to the NASN, National Association of School Nurses, because they have the tools for the school nurse to use. We don't, that's not our forte, and the accountability and liability is with the School Nursing Association. So we do link them. If they were to contact us, we would send them to NASN.
And I know you said you had made your materials accessible as far as putting them in another language, like in the Spanish language. Are there any other accessibility features that you have, like with your websites for people who use screen readers or are hard of hearing, or have you done anything to set your website so that it meets the compliance laws?
Right. So my understanding from our web developer is that she is our compliance person and has really taken that compliance issue to light to ensure that the readability, accessibility is on the website, so that when there are readers or when readers are being used, that the person recognizes what or understands what's being read, versus just alt text that say picture, that it actually describes this is an inhaler, it's round, it's square, color purple, that goes through the whole description, because she herself has some concern that way. So she herself is looking for accessibility. In regards to hearing, I'm not sure. I'd have to go to her to verify what we are doing for hearing.
Oh, and I just asked that in case you have videos or anything like that that they're captioned and things, because
Yes.
that's
Oh,
what I do at the
yes.
university. I'm not in the environment, but more accessibility. So that's why I
Okay.
asked the question.
Yes, okay, I understand. Yes, so we do have the transcripts for each of
Okay.
our videos, and then we also, depending on the webinar or depending on the content, if it's deemed for a healthcare provider, then we will pull that to be a plain language summary because we don't want patients or caregivers to feel less than when things are for, like, I use air quotes, for health practitioners. Like it information is for everyone and it should
Hmm.
be for everyone. And so we do make sure that there's plain language summaries describing what the outcome was of those webinars.
Okay. Thank you.
Sure.
So I want to go next to Precious. She was a former student of mine and she is getting into nursing. She has a couple of questions here. I don't know if Precious, did you hear the answers to your questions or you have follow-ups? What
Um, yeah, I did have the answer, but I also have a question. For me, like, when I first had my asthma attack, that was like I think 14, back in like 2014 in Malaysia. Didn't really have like a asthma back in my home country, home country. But then like when I got to like Malaysia, probably because of the air quality, I started having the allergy allergy and yeah. So I don't know because when I was younger, I never had like asthma attack. Emily? Thank you. I never had like the asthma attack, but so I was wondering, is it because of the air quality or I don't know, but I do notice like when I was younger, we had like cats and dogs and I always like sneeze around them, but I never had like difficulty in breathing until I got to Malaysia. And in Malaysia, we didn't have like any pets, but then every week like I had to go to like clinic and then they give me like some type of injection and every time like the doctor gave me like the injection I feel like I'm so released like I can breathe better.
Yeah. Yeah, and it could be that if you're moving from country to country or state to state, that you're being exposed to different things that are in the air, or maybe being in Malaysia, there's something there that is your trigger that we just don't, maybe can't identify. And dogs and cats, because of their dander, can cause an asthma reaction if that is one of the triggers that causes your asthma. Because not everyone that has asthma is allergic to dander, but some people are allergic to dander.
I see. Thank you. My other question is that is it gonna be like for the rest of my life? Because when I was younger, I didn't really notice if I have it though, because I did play with like my pets. But like I mentioned, like in Malaysia, I did have like that problem like mostly every month. Probably because I live with like other people in a crowded apartment. But like when I move here, it kind of like goes away. But back in the state in Kentucky. I always get like allergy, like especially this seasons, like
Yeah.
April, like when the flower blooms and stuff like that. But then when I came here, it doesn't really. I don't really get like asthma anymore, and unless I'm stressed and like maybe like some food that I eat, I don't really have like any food that I'm allergic to. But I don't know for some reason grapefruit. That is like I don't know. Yeah, I can eat like oranges, I can eat limes, I like sours, I like fruits, but then grapefruits, I try it like every time. Like I think I have tried about like 5 times, and every time I eat it, it makes me sneeze and I can't breathe, and like my tongue became like rushness. I
Yeah.
don't know why.
Yeah.
So I was
There's
wondering like, is it like something related to asthma or just like my food allergy in general?
So there's something called, there is a relationship there with food and the asthma reaction that you're having. And I'll have to send Dr. Murray the link to the information for you to read. But ideally, people do not outgrow asthma. Asthma is a lifetime. We're starting to see new medicines come out that can change the way that people respond to their triggers. And there's even a concept that's coming out called remission, similar to cancer remission or diabetes remission. We're starting to hear these words in this respiratory space for people with asthma. So we're still trying to define hearing in the, healthcare researcher space on if it's on medicine, off medicine. But we're definitely seeing large strides in hopefully finding some way to help people with asthma have a remission where they're not having these type of situations that you're describing.
Thank you so much.
All right. So, Princess?
Try to keep it very short. Thank you very much. This was wonderful. Many times when you're dealing with people that are having problems, it can truly touch your heart. And you try to do as much as you can. And at the end of the day, you know that what's missing is funding. But you have been priceless beyond funding. So thank you very, very much.
Thank you.
Yes, thank you, Dr. Murray, for inviting her. He told me he had a surprise for me, a special gift. I'm like, money to help the program, But
Yes.
this is even better than money. And if some of you who understand where I'm coming from, you understand that resources and people connecting is essential.
It is.
So we have what's called Brave Voices of Asthma. When we first started out 3 years ago, we came up with that to listen to asthmatics, to let them be the feature, to let them share with us. And what that does, it really tugs at your heart. So when we started listening to a mother who says, my mother died of asthma. Every person in my home has asthma. When we listened to a young man who said, my mother died the day before Thanksgiving, and my 3-year-old daughter died a year ago on that date of asthma. When I realized that my cousin was driving down a street in Benton Harbor and had an asthma attack and died, like, wow, asthma for someone who's not asthmatic. So our Brave Voices of Asthma gave us this opportunity. So I have to reach out, touch, support, and love asthmatics. That is our mission, our goal. And it has really turned the table with this new journey in my life of what I'm doing now. That is so important to me. So I hope we can definitely meet later because my questions and concerns and everything that I have to talk to you about would take more than just this Environmental Fridays. But some of the things that, yeah, I surely hope so. But some of the things you mentioned about the devices, and I would like to know more about that. But our event is the one that's happening on the 29th of May here in Benton Harbor. And this is the city that you heard about, the mothers who are dying, the children. We had a 10th grade, she was 10 years old who died a couple years ago. It rocked our entire community because it rocked that school. It made people start paying more attention. And so our A for Asthma program is way over our head, and we love it because we are able to embrace all of these people who never had an ear or a heart or a shoulder to lean on. So when it comes to devices, they're saying, well, we can't afford them. I just talked to someone who says she shares her device with her son. She knows that she shouldn't, but he can't afford one. I'm like, wow, I gotta call Susan. What can we do about that?
Yes.
Are there programs with our event that's happening on May 29th here in Benton Harbor? Are there programs, if not yours, that can actually donate, if not, inhalers, there's the peak flow devices and some other materials that is of substance to people who need them outside of the literature and the education that we will be providing. Do you know of any other organizations, if not yourself, that can actually donate asthmatic supplies for May 29th?
Yeah, so I'll have to do some homework for you because we are not able to, we don't have the resource for medications. We do have resources that connect people to assistance programs through different industry partners, whether you have insurance, don't have insurance, so forth, and how to make that happen. So we can definitely do that part. in your area, we do have a few of our what we refer to as ambassadors that are in your area that might be able to figure out some other opportunities for specific resources, rather that be peak flows or spacers that you're referring to. So let me do some homework, and if you don't mind emailing me, then
Oh yeah, we will.
that way we can connect, because we'd like to keep that relationship going for sure.
Last year we were fortunate to have EPA there with us, and they
Yes.
brought the pig
Lungs.
machine. Yeah,
Yes.
the pig lung
Yes.
machine. Unfortunately, they're not able to travel.
No, they're not.
So some of the things that they were able to help us with, they're trying to.
Mhm.
Do you have, again, when you start searching for maybe peak flow, they actually did share with us how we can purchase one. I don't know if we can purchase one and have one available and be trained on it by the 29th. So it will be maybe during September, asthma peak awareness week, or some other time, or the next year, or whatever we're doing, because we have, just like you, we have asthma in the schools, asthma in the churches, asthma in the park, brave voices of asthma. We're all over making a difference, and now you have enhanced us with just this Environmental Fridays to even do more for people, so thank you again. But do you have anything, and where are you physically located?
Oh,
Number
so
one.
number one, our organization is located in Virginia. It's domiciled in Virginia, but everyone works remote. I am physically in San Antonio, Texas. And in regards to resource for the lungs, I believe there's a respiratory therapy program close to you. And I'll have to do a little bit of homework there too, to identify who that is, to see if we can connect you so that you all could work together. But usually a respiratory therapy program or a nursing program will have those lungs as a teaching tool.
Wonderful. Well, there's so much more, but I would like to wait to after the program to connect with you, and see how we can actually even help each other.
Exactly.
And again, money is so important, but what you just provided today, for me right now, sitting here trying to put this program together, we're halfway there though. It was priceless, and I really appreciate you. And to our beautiful co-hosts, there is so much you can do. Your church is so powerful, and you're already doing things, and you have people who work with their hearts at your church. We're at the Vincent Place, downtown Benton Harbor. You can volunteer for our program on May 29th. You can contact me via Dr. Desmond Murray, and there's so much that you can do personally, but it is because of why we understood the true importance of bringing Dr. Yvonne Larrier on board to help us with our emotional wellness program. Because, like I said, we have people who are dying and people who have died, people who are suffering, and people who have never, we hear about breast cancer month in October, but it's really rare that it's been an intentional in our community, in our county, an intentional effort to know more about asthma in May and what it means for the month of May, but 24/7. So we're making that happen, but you can definitely, beautiful co-host, is to join us, the A for Asthma program in Benton Harbor, that's helping people. Because back in 2017, for Black adults, they have not done a study on children. There's been many studies, just like for Black children, 8 times as many Black children are dying of asthma than our white brothers and sisters. And so now when we look at in our community of Berrien County, 1 out of every 4 Black adult has been diagnosed with asthma. So you can definitely help us in many, many ways, and we'll connect as well. Again, I thank you so much for this opportunity to listen to what you had to share and to actually form a stronger partnership later.
Thank you. It's been lovely. Thank you.
All right. Any other questions, comments?
Desmond, are you able to later via email send us people's contact information?
Oh, absolutely.
Like Dr. Gardner's and Princess's?
Oh, yeah, I could do that. Not a problem.
Thank you.
Okay. All right. If there
I
are,
do have to go though because it is graduation weekend
I
and
know.
my program has a thing at 11.
Okay. Well,
Congratulations.
thank you.
Thank
Thank you
you.
very much
Bye,
for
guys.
co-hosting.
All right,
Take care.
We'll be in touch.
congratulations.
We will.
Thank you.
All
All
right,
right. Anybody
thank you.
else? Final words, questions?
Thank you so much.
All
I
right.
look forward to hearing from you guys.
Okay, sounds good. So
All
we
right.
will bring us to a close if there are no more questions. Dr. Gardner, you wanted to say something, or Gwen?
I just said thank you very much for bringing me in and starting this collaboration and conversation with all of your members that have joined today. And we really look forward to returning and introducing you to some of our other teammates.
All right, sounds good. I look forward to that too. Thank
Dr.
you
Gardner,
very much.
Dr. Murray,
Yes.
I just want to say thank you. Thanks for the presentation. My mother was an asthmatic for most of her life. She died at 91, not of asthma, but I understand asthma, most of my family. Dr. Murray, it may be a wonderful feature to have persons consent on a weekly basis to have their contact information shared. So it's just a thing. Somehow you can work it that if you want to share this, the persons attending in this feature, please submit your numbers and then you share it to those submitted. Just a thought. Thank you so very much again, Dr. Gardner.
All right, thank you.
Bye-bye.
All right, so thanks again, Dr. Gardner. Thank
Thank you.
you, Alyssa. I know she's left the room, but thanks anyway. Thanks for all of you who attended today, who participated, who listened. And we want to, ask everyone to take what you learned today and try to proactively help in some way. You can see that there are different programs and organizations and resources that could be utilized, and some of it is free. So take full advantage of all the information that was shared here today. So we're going to sign off, and we wish everyone a wonderful weekend, and hope to see you back here next week, Friday. If it's Friday, it's Environmental Fridays. It is personal. Take care, everyone.
Thank you so much. Happy weekend.
Thank you.
Thank you.
Dr. Gardner.
Bye.